Hello, I'm Jason Howland, and welcome to Speaking of Health, the place to help you learn how to live a longer and healthier life. March is Colon Cancer Awareness Month. Colon cancer is a disease that kills tens of thousands of Americans every year, and it's a disease that in many cases can be found early, treated, and possibly prevented. Joining us today is Dr. LeRoy Hodges. He's a board-certified general surgeon at Fairmont Medical Center, which is part of Mayo Health System, and he's someone who's very passionate about this subject. Thanks for joining us today on Speaking of Health.
Thank you, Jason. You know, at least 150,000 Americans every year will be diagnosed with colon or rectal cancer, and this kills approximately 50,000 Americans every year. This is a cancer of the large intestine or lower bowel. Most of the time, this begins as benign, non-cancerous polyps. The person who can have the best effect in preventing a colon cancer or being cured from a colon cancer is you or the patient themselves. We recommend a screening program that generally starts at about age 50, and if that screening program were implemented for all patients and all people in the community, it would prevent or cure almost all colon cancers.
Now, when you say a screening, what exactly is a colon cancer screening? What happens?
A screening test, that's an important point right there, because we all know that when we're ill or have a problem that we frequently need tests to diagnose what the problem is. A screening test is a test done on a person who's perfectly well. They have no suspicion of any kind of illness. For colon cancer, we start the screenings at about age 50 because the risk goes up with age. And the screening for colon cancer is a test called a colonoscopy. This is a fiber optic scope, which is like a long flexible telescope with a TV camera literally at the end of the scope that we're able to guide up through the colon or lower intestine to be able to examine for any benign precancerous polyps or cancers.
And is the patient asleep when this is happening?
Absolutely. I generally tell my patients that they might be a little bit nervous about their first colonoscopy, but they won't be about their second, because I guarantee they get through it well without remembering anything about the test itself.
And you talked about polyps as something that you're looking for. What are polyps?
Polyps are like small growths that can turn into cancer. And the technicalities of it are that the lining of the colon needs to be constantly replaced because it's worn away by what passes through. So these cells of the lining divide constantly. Well, if one of these cells has a mutation where the DNA or chromosome is damaged, it might forget the signal to stop dividing. The room is too crowded, stop. Well, it doesn't recognize that anymore. So they keep growing and dividing and growing and dividing until it humps up and can grow into a bit of a lump. That is not a cancer at this point because they just sit there. They just happily divide and sit around. If one of those cells now in the polyp, which can number millions or billions of cells, has an additional mutation, a different mutation, now it's hungry. It wants to eat anything around it. And of course, now it's a cancer.
And can it vary with patients? Can some patients have just one single polyp and some have hundreds? Or is it usually a lot of them or none?
The vast majority of patients have no polyps. Mm-hmm. We find polyps in a screening program in 20 to 30% of patients in a ballpark number. However, there are certain circumstances and certain genetic conditions where people might have thousands of polyps, literally. Those patients are at high risk of developing cancer before the age of 40. That's a small number of patients. However, a lot of patients will have 1 or 2 or 5 polyps. It's a smaller number that have many.
Is the analogy, would it be similar to, say, skin cancer? A lot of times skin cancer starts as a mole on your skin. Is a polyp sort of like a mole inside your colon?
That's an outstanding analogy because it gives us something that we can see and that we've all known about that we can then translate to something that's happening internally that we don't really have much understanding about. Honestly, a polyp is very much like a mole that can sit there for some time and then can transform, as we call it, into a cancer. So that's a very good way of looking at it.
So does someone need to feel sick or have symptoms before having a colonoscopy?
One of the sad things about colon cancer is someone can literally have colon cancer for 5 years and yet still not know it. Wow. And it's during those 5 years that cancer is growing and potentially spreading to distant sites where it's now impossible to cure. Our aim is to find that cancer before it has a chance to spread, and that means looking when the patient is not ill. That's the only way to reliably find it early.
And the magic number generally is age 50 for people?
Correct. For the general population, age 50 is when we start because the risk of colon cancer starts to grow tremendously starting at about age 50. From age 40 to age 80, your risk of colon cancer in a single year goes up probably at least 10 times.
So I know you said many patients won't have symptoms early on in the disease, but what if the colon cancer has progressed? Then what are some of the symptoms?
What the patients want to watch out for are the classic warning signs that we might hear from the American Cancer Society. The blood in the stool is something that everybody gets a little nervous about when they see it. Unexplained weight loss is a very important thing. We all like to look for weight loss and we try endlessly. It's when we're not even trying and we lose weight that becomes a bit of a concern. Abdominal pain. Most abdominal pain is not cancer, but it's certainly something that needs to be checked out. And changes in the bowel habits where things are just not normal anymore.
And if you have any of those symptoms, you should
go to your doctor, talk about them, and come up with a plan for investigating in the best way for you.
So, Dr. Hodges, when you're performing a colonoscopy, you have that camera inside the colon. You're able to see pretty well, I'm assuming.
Correct.
What exactly do the polyps look like as you're looking at them with the camera, and what does a cancer look like?
Well, the lining of the colon is relatively smooth. We're in a tube, literally, and the tube has little bends and twists and has little folds in it that we generally can see around pretty well. A polyp might look like a mole, a flat kind of lump on the side of the colon, but sometimes they can grow enough so it almost looks like a mushroom. The polyp might be the head of the mushroom, and the weight of the polyp would stretch out the soft lining of the colon until it's like a stalk. So it could be like a cherry on a stem almost. And those are pretty easy to remove. The flatter polyps are a bit more difficult to remove, but generally can be removed.
And the cancer, if it's actually cancerous, what does that look like?
A colon cancer is about as ugly as you would imagine. We always think of cancer as an ugly disease, and they look ugly. They truly do. They tend to be irregular, red and angry, bleed easily. Sometimes what we call ulcerated, which means part of it's dying and it's a white, ugly base. So if it's ugly, there's a decent chance it's a cancer.
When you're performing a colonoscopy, you can actually remove some of the polyps with the scope, right?
Exactly. The medium to larger size polyps, we use what's called a snare, which is very much like a wire lasso. We lasso that polyp and we tighten up the lasso. It's basically a loop of wire with a plastic sheath. We put the loop around it, slide the sheath forward to tighten up the loop, and we run electricity through it to both burn through the base of the polyp and cauterize it, which helps prevent bleeding.
So actually, a patient that has polyps, they don't need to come back for another procedure. Actually, while the colonoscopy is being performed, you can take care of those polyps.
Correct, and that's one of the big advantages of colonoscopy as a screening tool for colon cancer, is we can frequently biopsy problems and remove polyps at the same sitting rather than coming back for an additional test.
So who's more at risk for getting colon cancer?
Obviously, as we talked about, the biggest risk is age. Men get colon cancer a little bit more than women, but it's a big, important problem for both genders. African Americans have a little bit higher incidence, but again, it's only a small difference. People with what we call risk factors, we really watch out for. Family history of colon cancer, or certain diseases of the bowel, such as colitis, which is an inflammatory or inflammation of the colon, like ulcerative colitis, increase the risk. And there are some genetic traits. Some are patients who have hundreds to thousands of polyps that we spoke about earlier, and there are some where there aren't polyps involved that people can be increased risk, such as Lynch syndrome, which is a small percentage of patients.
How about lifestyle factors, exercise, diet, smoking, that kind of thing?
Those are relatively minor factors so far. We would like to find some environmental factor like a diet or a chemical that if we got rid of it would prevent all colon cancers. We're not there yet, but we know that, number one, if you're healthy and strong, if you get a colon cancer, you're going to recover better from the treatment. We also know that certain things can reduce the risk. If you're at a healthy weight, if you don't eat a really high-fat diet, and interestingly, small things like an aspirin a day may have a beneficial effect. Vitamin D seems to have a beneficial effect. So we're looking for more and more of those ways to help reduce the risk.
How about high-fiber diets? Do those help?
High-fiber diets have been up and down in terms of whether they help with colon cancer, and we've heard about that many times because it's gone yes and no and yes and no in several cycles. Right now, we don't think that a high-fiber diet directly prevents colon cancer, but clearly it keeps our colons healthier, keeps our bodies healthier, so it's an advantage in that respect, but it doesn't directly prevent colon cancer.
Well, just like any other cancer, I'm assuming there's different stages of colon cancer, right? And what are those?
The stages go by number with various factors that help us find the number. They go from 0 to 4. 0 means a cancer that's just begun. It has not even gone through the top layer of the bowel. A stage 4 cancer has spread to distant sites such as the lung or the liver, and in most cases those situations can't be cured. But the stages in between, we can have a great effect with surgery, sometimes surgery alone, sometimes surgery with chemotherapy added. With rectal cancer specifically, radiation can be helpful.
You talked about surgery. What does surgery encompass when you have colon cancer surgery?
Typically, a surgery is going to involve removing part of the colon. In the vast majority of cases, we put the colon back together so people function normally. In the Mayo Health System, and in addition at Fairmont Medical Center itself, we have the advantage of having experienced surgeons doing laparoscopic surgery, and we have advanced that technique such that we're having very safe, reliable colon surgery done laparoscopically.
And what do you mean by for folks that don't know, what is laparoscopic surgery?
Laparoscopic means we make very small incisions, such as in the belly button, and sometimes we'll call it belly button surgery, where we bring like a narrow telescope with a camera on the end through there, and we can look inside the belly, and with other small punctures we can have instruments where we can manipulate the organs, including the bowel. We can divide the bowel or cut it and put it back together with very small incisions.
How small are we talking?
The incisions that we're working through with the laparoscope vary from a half an inch to an inch. When you're removing a portion of the colon, we always need an incision somewhere between 2 and 3 inches to be able to remove that portion of the colon. That compares to an open operation where we'll do a 6, 7, or 8 inch incision to do the operation. So there's a dramatic difference in the recovery. The patients are home earlier, they're stronger, and they have less pain.
And they have less scars too, right?
And absolutely. And that's, that doesn't seem important the day of surgery,
right,
but it's a kind of a nice benefit about 6 months later.
Right. Let's say other than surgery, what are some of the other treatment options? I know you talked a little bit about radiation, but is it like other cancers, chemotherapy and that
Correct.
kind of thing?
Colon cancer has to have surgery to be cured. There aren't any cures available now that don't involve surgery. However, when we have a cancer that is spread to the lymph glands locally, not distant, but just locally, we'll generally recommend chemotherapy. That's for colon and rectal cancers. For a tumor that's spread to distant sites, there are things that we can do to help a patient have a longer, more enjoyable life, but we generally can't find a cure. With rectal cancer specifically, radiation can be helpful in improving the chance of cure itself, because a rectal cancer is limited right there in the pelvis.
If I go have my colonoscopy and I have no polyps, how often then do I have to have another colonoscopy?
With no risk factors and a normal colonoscopy, you should have another colonoscopy in 10 years. Now that makes people smile. They don't mind waiting 10 years for the next colonoscopy with the good news. If you have polyps that are precancerous, it varies by how many and how large. One small polyp means a colonoscopy in 5 years. Several or larger polyps means a colonoscopy in 3 years.
Lastly, are there any certain steps that you should take in life to help prevent colon cancer?
Surgeons typically have to treat and operate on major problems. We don't ever get to prevent anything. But interestingly, colonoscopy itself, if we remove all the polyps, we actually prevent some of the cancers, because not every polyp turns to cancer, but every cancer started as a polyp. So that is one thing that we really enjoy, being able to prevent a serious disease. But for the patient themselves, or for the healthy person themselves, a good diet, good exercise, staying strong, avoiding alcohol and avoiding smoking. And there's a couple things that I mentioned: taking an aspirin a day, and probably vitamin D, maybe as part of a multivitamin, probably have some small but real effects in decreasing the chance of getting colon cancer.
And get that colon cancer screening, because that's the best way, right?
Every person should meet with their doctor and discuss what their screening program should be, because we vary it according to the needs of the patient and what their health status is, etc. So we want to individualize it for every patient.
All right. Well, unfortunately, we're all out of time, but I want to thank you, Dr. Hodges, for joining us today on Speaking of Health.
My pleasure.
And have a great day, everyone, and be healthy.